JackyOh medical examiner proves that the doctor's office was not supposed to work on her. To find out what happened, watch this whole video and subscribe to the channel.
One of the things we should look out for. Was your surgeon board certified?
He said he was board certified. There was a piece of paper on the wall, but anymore, I don't know that I trust it.
There's a way to check, though, doctor. You said.
The best way to check is ask your surgeon if he's allowed to do that particular procedure in a hospital. Because
and I want to let y'all know, JackyOh, she asked him, is you certified to even do these procedures? And just like the doctor said, and I want you guys to know, she already asked him, and did he lie to her?
Exactly. What did he pull out of his pocket? Because the board certified is not a ID card that they give you. It's supposed to be embroidered onto the wall, actually hanging up inside the picture frame. And when you went and looked at the wall, they didn't have the correct one. That's how you know that the board did not certify them, because you can triple check these kind of things. You can go into the database and actually look through the health department for this. And the fact that the health department comes around every 6 months to let them know if they even going to be able to retake the test, but they couldn't do it. And so this is what they said about the whole place and what was happening to the other people.
Afterwards, when you were so upset, I'm so disappointed in what he said.
Everything's going to be fine. You're
Slowly
crazy.
come down. Give it time.
Come down. Give it time.
So you had to redo it.
so I redid it. I converted it to the proper technique, and it came down, and she healed, and I think she looks pretty amazing.
She looks beautiful. You look really great.
You can show us later. Okay.
R.I.P. Miss JackyOh, because like they said, she looked beautiful after it was done. Everything went fine.
They seen JackyOh was blue by the time that they came into the room. That means a person has to be at least 6 hours without the oxygen for that to happen. And everybody knows this, because when you really look at the fact of that the stethoscope and the scans do not actually match up. This is why they're saying that something is different about the JackyOh situation, for the fact that you cannot trust, for the fact that the 1-star rating nurses and technicians that's working on her and everything. Like, just look at the Kevin Samuels, where it was somebody who actually knew his exact weakness that put him out.
And everybody can really put their finger on the sophistication. We all can put our fingers on the lacerations that she had basically around the upper part of her body. I want you guys to look at it, and this seems like it's malpractice. When I really look into this, it looks like, from what the reports are stating, he wanted to basically send his regards and his well wishes to the families of all of the people who he basically worked on in the past, but he didn't specify basically the injuries that was left on JackyOh. And I want you guys to know, if you know anatomy, you know for a fact that the integumentary system above the neck, anything that happens above the upper chest, anything, any lacerations, any bruises, marks, anything. They said that she was not even the same color that she was, and she didn't have on any makeup or anything. And I want to basically send my condolences out. And I have a question for you guys. And I want you guys to let me know in the comment section, because we want to know if it wasn't any faulty play or anything that was basically did. And I know it was more than one person in the room, because from what the initial police report says, it states that the 3 witnesses, which was Dr. Okio, and we know for a fact that he have his 2 assistants in the room. We can look at this and really pay attention and place our finger on the fact that she was in there by herself. We don't know if she had complications inside and then they fixed it, and then when she basically got diagnosed and they basically discharged her from the hospital or the clinic that she basically did this surgery at. Once she went home, she started having more complications. This is why she basically couldn't do what she had to do and pick up the phone and call her husband, her family, anyone to basically check on her to make sure she's good.
And the incisions had to be too large, because if it was 3 millimeters on the upper diaphragm, that's too much fat tissue that would be clogged in the vein. And they know that this is one of the ways that a lot of people have been getting taken out with these procedures that's been going on the operations table. Like at this moment, the vice president of the medical staff told them that they should not even be offering this type of service no longer. Like it was just a moment of time until they actually pulled the cords on the whole entire franchise. Like the fact that this wasn't working out for any of the people, man. And when you go back and look at the specifics of JackyOh's case, she came in, her paperwork says she's 5'11". At this moment, they should have known exactly how much to give him, because the syringe was pulled back way too far when they dipped it into the concoction that was inside the cup. Everybody knows that you have to sterilize this whole thing. So when you cannot use the same wet wipe pads. One of them is for scrubbing and the other one is for wiping it away. Like the reason why they had the blue actual paper towel that goes on top of the Petri dish that holds every single tool for this. So when the person is standing right there and he asked for them to give him the fork, that's when he went down, and if something dropped, that caused a large incision into this, and it was in a place that it wasn't supposed to be. I want y'all to know that they had a light shining exactly in the spot that it was supposed to be. And if any of y'all know this next thing, I want you to tell me, because how long does it take for somebody to go out from the anesthesia? Because that's really what's gonna tell if she felt them make the botch or not. Because everybody wants to know what exact moment is it, because just like how they have everybody has the knee-jerk reaction when somebody has the botch. The body moves in a certain way. When they hit the vertebrae that has the funny bone in it, that's what makes the movement, and they should be able to see that.
And I know for a fact, whenever someone gets surgery, they have to go past the ligaments and tendons. Everyone knows for a fact that sometimes you can't come back off of it, especially if you hit a main nerve. Your nerves like literally the nerves in the surgery, this is why they call it botched. I want you guys to know the nerves will literally like be gone, like out of there. Like they won't be functioning correctly is basically what I'm trying to tell you guys. I want you guys to really look at this, because in the medical field, we know for a fact that you can't place your finger on certain instruments and certain tools when you're doing certain procedures that don't go for that operation. I want you guys to really look at that, because we can really pay attention to the fact that this woman, she lost her life. And I want to send my condolences out to her family. And I want to basically let dcyoungfly know that everybody, they're working very hard to get down to the bottom of this. And we know for a fact that it should be some type of compensation with this injury that happened. This was a sad situation.
Exactly, and it was really the fact that it was 2 molecules away from where they could have saved Jackie, and whether it was going to be something that was going to decide the fate. And so everybody knows at this moment that when you really look at the forensics of the situation, they came back with the autopsy result, and it said that this was due to a lack of functioning parts, like the organs and everything. They have to work in a certain way. And when it's affected by as much anesthesia and everything, for her to be 5'11", and what it's saying between 175 to 177 pounds, like this, there's a certain amount that you're supposed to have. Like anybody that's in the 3rd year of medical school as an assistant knows that to get the RNA and the CNA, you have to pass the board exam and get above a 2-star rating. So how is the place getting away with having a 1.6 star?
And whenever you have to take the state board, a lot of people, they don't know, but Dr. Zack didn't pass the NCLEX course that he basically had to study. And I know a lot of people say that the state board is the certification state like test to where it makes it to where you can go on to get the certificate and the license to be able to carry on. Every 2 years you have to certify and basically renew it. And this is something that a lot of physicians know about. I want you guys to hit the like button, subscribe to the channel as soon as you basically get word or update that JackyOh, she's, man, it was a sad situation, but she's in a better place.